Thanks, Rich, for coming to spend an extra time with me this morning. I wanted to just share with the people back home in Japan, really kind of, they may already know who you are, but wanted to kind of get a little personal touch on getting to know you before we spend some time next January with the seminar. So if you could tell me where you are currently and what your responsibilities are at your institution.
Absolutely. Well, thank you for having me. Happy to chat with all of your community and physical therapists around the world. So I'm a professor at UC San Francisco. And so obviously that's in San Francisco and California on the West Coast of the United States. I've been at UCSF for about 12 years. I am currently a professor and the vice chair for research. So I balance my time between research, teaching, administration, and a very little bit of clinic time. And I am also the program director for the PhD in rehabilitation science. Nice. So those are my responsibilities very broadly. Specifically, I teach gait and running biomechanics to the first year physical therapists. I have a course in radiology during the second year of the curriculum, and then an elective in running biomechanics, where we get into kind of the specifics about running biomechanics. So that's my teaching in the DPT curriculum. And then in the PhD, as being the program director, there's a lot of administrative tasks and ushering students along the different tracks that we have, and mentoring. But I really very much enjoy mentoring kind of emerging researchers. So I enjoy that aspect of my career very much. And then on the research side, I primarily study lower extremity biomechanics. Knee and hip osteoarthritis has been the area where I have done the most studies, but I'm also interested in things like patellofemoral pain and IT band. And I even have a new grant that's looking at gait retraining in amputees. And so lower extremity biomechanics movement is kind of my scientific passion.
Mm-hmm. Wow, it sounds like you have your plate full, and so nice to be doing all these different things. I should tell you that the prevalence of knee osteoarthritis is super high in Japan, and you may already know about this, but I think that's why there's going to be a lot of interest in people wanting to come hear about what you're researching with the quantitative MRI studies.
I actually did know that, and there's some really good studies that have been done on older adults in Japan that have shown some really high rates, and part of that is mediated biomechanically, and so that's where I'm very interested in how we as physical therapists can maybe modify those gait biomechanics and have an impact in the trajectory of the disease. And that's actually a good segue, because that's where the advanced quantitative imaging that we do at UCSF really starts to give us insight into changes within the articular cartilage. It doesn't appear that once the cartilage has been damaged to the degree where there are lesions within the cartilage, we have much potential to regenerate. Possibly in the future with stem cells and regenerative medicine, we'll be able to get there. But without those kind of new therapeutics, the body's ability to regrow cartilage appears quite limited. But these imaging techniques that my colleagues at UCSF have been part of the group to develop, and there's others across the world as well, allow us to see the very earliest changes in osteoarthritis, where there may still be some potential to affect the disease kind of trajectory.
Yes, I also agree that the earlier we can catch and intervene with something as cheap as trying to correct how people are moving, I think we can make a big impact in the overall healthcare system and the cost as well.
Yeah, and that's where I think your connections with Washington University in St. Louis and that movement science program is so critical to our profession, because they have such a just a razor focus on movement and understanding how movement can affect disease trajectory. And I'm such a big fan of of that program and all that they're doing, and I'm happy to to see that they continue to grow and put out fantastic physical therapists and scientists.
Yeah, thanks. And we'll look for great therapists coming out of UCSF too. They're lucky to have you as their faculty. So
yeah, thank you.
Going back towards the beginning of your journey,
Yeah.
how did you choose to become a physical therapist in the first place?
Yeah, thank you for that question. I think like probably many of us, I don't know that I chose physical therapy. I think it kind of chose me. I was at a point in my life, in my career, that I wasn't sure what I wanted to do. And my first introduction into movement and health was through athletic training. And so when I was in college, I had discovered athletic training just for my love of sports and movement, and didn't really know the medicine side very well. And so as a college student at UC Davis in California, I was working with the sports teams and learning about injury prevention, but also rehabilitation. And we had a fantastic staff. We did have a physical therapist on staff, but some really, really great athletic trainers. One of the things I was uncomfortable with in athletic training was many of the principles we were learning of how to treat athletes, either from a preventative perspective or rehabilitation, we were doing because the person ahead of us said that's how you do it. The boss, the head athletic trainer said this, and he was taught from his head athletic trainer when he was a junior athletic trainer. And so there's this translation of skills down a lineage in a less traditional path than kind of evidence-based practice and peer-reviewed research. And so we weren't reading articles very much in the athletic trainer. We were really doing things because through experiential knowledge, which shouldn't be discounted, experiential knowledge is very important. This was what worked. But I was uncomfortable without being able to see the science behind why it worked. As a young learner, I really, really craved that. And I found that in the rehab room. And so we had, like I said, a physical therapist, but an athletic trainer who was just phenomenal. And she was really practicing physical therapy. I mean, she was a very skilled rehabilitation expert. And she knew the evidence, and she could point me to articles, and she could tell me why we were doing certain aspects. And I felt comfort in that security of being like, okay, this has been proven through evidence that this is why we're doing what we're doing. And I found myself spending every waking hour in the rehab room, and I would still go out on the field and do my emergency medicine stuff, which I like very much of athletic training, but really looking forward to those rehab hours. And I just was like, I think I want to do this. I think rather than athletic training, I want to be a physical therapist. I want to learn everything that I can. And so that started my journey. I became an aide in a local physical therapy clinic in Davis, California. And after a year of doing that, I was like, yep, this is where I'll go. And so that's how I chose physical therapy.
That's fantastic. And it sounds like this physical therapist, athletic trainer made a huge impact and an impression on this evidence-based practice. Who are some of your other key mentors, who guided you, influenced you in your career as a PT and also as a biomechanist?
Yeah, so many. I think that our community has a culture of mentorship. There's a lot of great guides in our profession, a lot of fantastic mentors, and I've had the privilege of having some amazing ones, starting with Lisa Varnum. So Lisa Varnum was that athletic trainer I told you about, and she's actually still at UC Davis to this day. She's a fantastic athletic trainer, but she's a even better person and mentor. And she really helped set me along a path, and did not try to change my mind from being a physical therapist. She's like, if that's where you need to go, that's fine. She's an ATC. She's not a physical therapist, but she set me on this path and gave me, great mentorship. When I got to physical therapy school, there's a gentleman named Steve Schmidt. He's faculty in the PNF fellowship out here in Kaiser. And he was one of my clinical mentors, and really just, he's God, he must be 6'6" tall, really tall guy, and he's got these massive hands, and his manual therapy skills are second to none. And I just learned so much from him. And again, career guidance as well, but just a very kind of special mentor when I was in the clinic. And then as I started my career into research, Jackie Perry, who was the medical director at Rancho Los Amigos, and her mentee, her PhD student was Chris Powers, and Chris Powers was my PhD mentor. And so that lineage of being able to spend some time with Jackie Perry in the pathokinesiology lab and working with her, I think when I was there, I think she was in her 80s, but the thing that was just so amazing is seeing her into her mid 90s, still coming to conferences and CSM and being so sharp. And she's to the very last times that I saw her, she was just as sharp as when I saw her in her lab, and being really critical of evidence and just an amazing scientist. And then obviously Chris Powers, my PhD mentor, had a huge impact on me. And then as I finished up my PhD and expanded out, a couple mentors that I know you're very familiar with, Shirley Sarman and Linda Van Dillen, are both continue to be amazing mentors for me. Shirley and I have amazing conversations. When I've had times in my career that I'm considering taking on a new direction or new responsibilities, Shirley's somebody who I reach out to, and we've had some fantastic conversations and discussions about what a career as a physical therapist and a career in research should look like. Where should my focus be, and I really value all of her efforts. And then Linda, just being an amazing scientist and seeing what she's done with her lab and being a mentor to others. I try to every CSM find a time to have some time with Linda where we can catch up. And so she's one that I don't have the opportunity to see on a regular basis like perhaps you do, but when I do, it's really kind of meaningful and impactful conversations, and I very much value her friendship and mentorship. So there's a few, and I could go on and on and on, both physical therapist mentors and outside, but I think those are a few people who have shaped my career.
And I think the funny thing about mentors is that we may not always be spending that time with them, but that key conversations that we might have, or that advice that we get, really set us on that right direction or that path, and then we take on from there. So I think those key conversations are so valuable.
Yeah. And knowing that you have them, knowing that, if I have this tough decision to be made on a career trajectory change or a scientific discussion, knowing that you have this person in your corner that you can reach out to gives you great confidence to be able to take on those challenges.
Absolutely. Well, we're so lucky to have you as our guest speaker for the January Movement System Monthly in 2022. I can't believe I'm saying 2022, but it's coming right around the corner. Yeah. What can the Japanese movement professionals expect to learn from you this coming January during the Movement System Monthly lecture?
Yeah, no, I'm excited to share my lecture with your community, and we're going to talk about quantitative imaging as a tool to understanding biomechanics. One of the things that has happened in my career is I've found great colleagues and mentors within the radiology community, and tools have been created in the last 15 years that allow us to look at very early disease. And you and I, as physical therapists, may see that tool very differently than somebody from a pharmaceuticals company, right? And so the things that you and I may be interested in studying are different from what others are doing. And so I have found a home, I've found a niche in a biomechanics approach to using these quantitative imaging tools. And they're emerging, and the post-processing tools are just exponentially growing in the last 10 years. And so I feel very fortunate to have the partners that I do in imaging. But I myself am a physical therapist and a biomechanist. Some people who read my articles think, oh, Rich is an imaging scientist. I don't view myself as an imaging scientist. I'm a physical therapist and a biomechanist. I use imaging tools to understand biomechanics. And so we're going to talk about imaging tools. And I've done a lot of work on cartilage, but there's other really cool things in bone metabolism, what the actual biology that's going on with the bone, as well as bone shape. We'll look at other tissues within the joint and how we can load the joint within an MRI and be able to evaluate kind of the processes that happen when you load cartilage. So that's kind of what we're going to talk about is a quantitative imaging approach to understanding biomechanics.
I think that's fantastic. There's sometimes there's a gap between what the researchers are presenting and what the clinicians can really incorporate that information in the clinical setting. I think it's always helpful for, you're still seeing patients, even though that may not be the bulk of your time. I think it's great to be able to learn from somebody who still has his hand in the clinic and knowing that what's going to be useful coming from your research. So thanks, Rich. I'm really looking forward to the January session. And thank you so much for your time today.
Thank you for having me. I look forward to our January session. It's going to be fun.
Awesome.
All right.